recent budgets have shown an increased commitment to healthcare, significant gaps remain in our healthcare infrastructure and manpower compared to other more developed countries, and that needs some policy intervention. The healthcare landscape in India is poised for significant transformation enabled by policy measures and leapfrogging progress in multiple technologies. As we look to the upcoming budget, it's crucial to recognize the progress made and the steps to be taken. While the recent budgets have shown an increased commitment to healthcare, significant gaps remain in our healthcare infrastructure and manpower compared to other more developed countries, and that needs some policy intervention. Let me speak through 5. Enhance healthcare spend. India's healthcare spend at a shade short of 2% of GDP is significantly lower than the global average of 6%. An increase to at least 2.5% of GDP would help enhance healthcare access and quality, particularly in underdeveloped and rural areas, and enable meeting the sustainable development goals to which our country has expressed commitment to. Second, strengthening human resources in healthcare. India ranks rather low in the doctor-to-patient ratio, and that calls for substantial investment in medical education, including increasing the number of medical colleges and seats. Healthcare education technology, or medtech as it is popularly known, can play a pivotal role in enhancing the reach and efficiency of medical education, making it more accessible, especially in remote areas. Incentivization could include grants, subsidies, or tax relief. Third, ramping up private healthcare infrastructure in Tier 2 and Tier 3 cities and rural areas. These disparities in healthcare infrastructure between urban and rural areas, as well as between Tier 1 and Tier 2 and 3 cities, is well known. That calls for targeted interventions to bridge through these gaps. Introducing a multi-year tax holiday for new healthcare infrastructure projects in such areas can incentivize private investment by lowering financial barriers for new projects. Enhancing healthcare insurance coverage. While out-of-pocket spend on healthcare has been steadily declining, it still remains north of 35%, which again bears improvement. Healthcare inflation has tended around 14%, which the government should take steps to control. Also, steps such as decreasing GST on health insurance and increasing income tax exemption limits for medical insurance will help in further increasing the insurance coverage. Scaling up primary healthcare spend is another area. There is a deep shortage of pharmacists, lab technicians, and nursing staff in the PHCs and CHCs. The number of ASHA workers and auxiliary nurse midwives need to multiply for India to meet its infant mortality and other such clinical targets. To conclude, the upcoming budget needs to embrace transformative healthcare strategies. A concentrated effort on increasing and integrating digital health solutions through Ayushman Bharat, Sanjeevani, etc., and enhancing health insurance coverage is crucial. Such a proactive and forward-thinking approach would be a visionary leap towards a dynamic, inclusive, and future-ready healthcare ecosystem in India.